Very pleased to welcome Adrian along.
Hello.
Adrian, how's it going?
Good, good evening. Yeah.
Busy couple of weeks, isn't it?
Yeah, been really busy actually.
Been hard worked, which
Absolutely.
is good. Yeah, we like you to earn your keep. So we're going to talk for the last bit of the show about dentistry, about looking after pets' teeth, and it is a really big deal these days, isn't it? I mean, we do quite a lot of dentals here. I did one the other week that was, you know, the dog had really gruesome teeth. And it was such a rewarding thing to do in many ways, isn't it? You clean them up, take the teeth out, and make such a difference.
It's rewarding for us, but it's rewarding for the pets and the owner as well. I mean, it's difficult to overestimate how important dental disease is. I mean, it's something that perhaps we as vets are guilty of, but owners as well. Generally speaking, I don't know how many times you've seen it, but over my career, very rarely have I seen an animal brought in with dental disease because they've stopped eating.
Yeah, I mean, even sometimes cats in particular, you'll get them with rotten old teeth. Horrible. And they're still eating, aren't they?
Yeah, and I don't think there's nothing wrong with the animal. They're absolutely fine, and there's nothing that needs doing. And that's not to say that once you've done it, they don't report, oh, actually, he seems much happier now. Animals are really good at coping with bad teeth and not showing you any symptoms. They still eat fine, they still seem fine, but not only with those teeth maybe causing them a problem in terms of pain, but if bacteria are crossing over into the bloodstream, that bacteria in the bloodstream can cause all sorts of damage. I mean, classically speaking, we'll be talking kidney disease in cats. You know, a lot of old cats get kidney disease. This could be why, because they're getting a lot of bacteria going over.
There's a real body of evidence then to suggest that's a real causal link.
Seeding out into the kidneys, and in dogs we can get heart disease. You know, older dogs can get heart disease because of bacteria seeding in the heart.
So it's obviously a big problem there. So what can we do about it? I mean, I guess there's vigilance on an owner's point of view.
Yes.
There's checking, having the treatments here, and then sort of prevention, things like brushing and.
Yeah, I mean, in terms of keeping your dog's or cat's teeth clean, you can brush the teeth, you can put additives in the water, you can feed them dental treats. There's evidence that shows that dogs fed on bones, although there's downsides in terms of you can get foreign body obstruction if you swallow them. Those dogs tend to have very clean teeth.
I mean, I suppose hard foods as well as opposed to eating tin food have
dental benefits. If you look at your cat or dog's teeth though and there's a build-up on the teeth, then you're not really going to get that off with anything you can do at home. The only way that's going to come off is in a veterinary clinic under anaesthetic where they're being cleaned up and polished, and at that point you can try and keep them under control. But if they've got a build-up on there, you're going to struggle to get that off. And really what you want to do, you know, check your dog's mouth out, check your cat's mouth out. If there's a bit of build-up on there, that can be normal. If there's a lot of build-up, that's more of a problem. But really what I look for in the gums of these animals is there a little red line on the gum? Is the gum that's next to the tooth reacting? Has it gone slightly red? And if that's the case, you've got bacteria that are crossing over from the tooth into the blood system, and you need something done about that.
And just a very quick final note, we talked about cats and dogs, rabbits.
Yeah, I mean rabbits and guinea pigs and hamsters, we see a lot of dental disease in those, especially rabbits. The trouble is that their teeth grow continuously, and you can get misalignment at the front, but more importantly misalignment at the back.
And in those species we do tend to see going off the food as presenting symptoms.
Yeah, because they're at the back, you don't notice it, they tend to grow and grow and grow, and then they're poking into the gum, they're causing ulcers in the tongue, really nasty ones, and they go completely off their food, and without corrective surgery those animals aren't going to get better. But with those, again, prevention is really the key, because once they get to the stage where you're having to trim them, generally you end up doing it monthly, you know, as much.
And prevention is down to diet, really.
Down to the diet, you know, it's all about making sure they feed hay. I mean, these pellet-based foods or muesli-based foods, they're okay, but they really don't need very much of them. I mean, you're talking like a teaspoon, maybe slightly more per kilo, so not a lot a day, and the rest should all be grass and hay, fibre that brines those teeth down. Yeah.
Lovely. Well, thank you so much, Adrian.
No problem.